All right, let's start today. So I am Dr. Russell Homan. I'm a board-certified pediatrician and lactation consultant, and I have an office here in Tallahassee called Canopy Pediatrics. You can check me out at canopypediatrics.com. And I am currently doing a video series on helping breastfeeding parents. The system I created is called the 4 A's, which stand for against, aligned, allow, and adjust. On Thursday, I published an article on against, the video on Facebook Live. You can look at my Facebook page. It's called Dr. Homan at Canopy Pediatrics, and you can see that video. I'll also post it at my website soon. But today, we're going to talk about the second A, which is aligned, which is very important. And I think this can be very helpful for a lot of breastfeeding parents or pregnant parents that are going to breastfeed, because I also work in the hospital in the newborn nursery, and I see people with poor alignment all the time. And yes, you're probably wondering, what do you mean by alignment? And I will get to that here soon. All right, so we're getting to it. So alignment has two parts. The first part is just the baby's alignment. The baby's head, neck, and spine. Is it all in a straight line? Or is their head too far back, too far forward? Or is their body twisted? Are they curved or bent forward? And I see people all the time with their babies nursing like this. If you bend your neck forward, it's pretty hard to swallow. And actually, babies do want their neck a little bit back. That helps them bring their jaw up. So like not perfectly straight, but just a little bit back. And then their spine should be pretty straight. And then maybe they do nurse a little better with their spine a little bit curved. But basically, we want their head and neck pretty straight. You know, not twisted or curved or arched or anything. Because babies, you know, they're not very strong and they need to keep their body well aligned. And the second one is good alignment of the baby's face, mouth to the breast. And this, maybe some parents don't really think about this because they just get the baby where they think the baby should be, and then they move their breast to the baby's mouth. And as I will talk about, I am not a fan of the sandwich hold or holding your breast for the baby. And I will get to this more in future slides. I'm more of a fan of seeing where the breast lies naturally. And if you saw my previous videos for S.O.S positioning, which stands for skin to skin, open shoulders and chest in a semi-reclined position, then it brings the breast up to where you can align the baby with the breast without having to pull the breast to the baby. So we'll get to that later. All right, next slide. So why do the babies need this alignment? Again, I touched on it a little bit, but from my last episode, I talked about how babies, what they do is they just nurse. That's their job. And that exhausts them. They sleep the rest of the time. And they're not very strong. As you can see in this picture, this baby is working very hard to keep its head and neck up. And the head and neck are crucial because your swallowing, your sucking, all goes wrong in your head and neck. And if the baby doesn't have a strong base, then they might have to, they might have to stabilize themselves with their mouth. And if they stabilize themselves with their mouth, because their body's not stable, they're going to bite down. And don't you think that's a little too much work to have a baby stabilize themselves with their mouth and try to suck and swallow? So this leads to nipple damage and pain, and it also can lead to poor weight gain too. So yes, very important that a baby has this strong base. Like you're in a basketball game, you're guarding people. And if you're twisted or curled up, it's kind of hard to move your neck right. All right. And then we talked about the second part of good alignment, which is the breast should be perfectly lined up with the baby's mouth. So if the breast and mouth are not lined up, the baby will have to either pull part of the breast in to align it. And again, you don't want the baby doing two things at one time. You don't want the baby having to align the breast and suck and swallow. Or, for example, we were talking about the sandwich hold, where the mom will move the breast to the baby's mouth, but then the arm will get tired and the breast will start to fall down or start to move back to where it was, and the baby will feel this pull, some people call it drag or tension, on their mouth, and they'll have to bite down to keep the breast from sliding out of their mouth, and then the poor breastfeeding parent starts to get nipple damage and redness. So we want the breast and the baby to be aligned without having to move the breast. This is so helpful, so helpful. All right, let's move on. All right, so let's go back to straight spine alignment. So as you see in both of these pictures, you can be in the cradle hold across the breastfeeding parent, and you see that great blue line where the spine is nice and straight. There's just a little bit of probably forward curve in the head, just a little bit back. So that's what you're looking for. But then you also see in the football hold, you can do it too. The baby is a little curve forward, the next little curve forward, which that kind of does happen in the football hold. It's not ideal, but it's okay. As you can imagine, in the football hold, you need to get the baby as far back as you can. I was just talking to a mother in the hospital the other morning that you need to wrap those feet back so you can get the baby back so the baby doesn't have to be curved forward, because they don't nurse good when their neck's curved forward. So I think this is pretty straightforward, just the straight spine, not too twisted, not too curved. All right, let's go on to the next. So again, the face, the mouth. As you can see from these pictures, there's all kinds of ways you could have poor alignment. You could have, as your top left picture, the baby's head could be at the wrong angle to the breast. And then if you're at the wrong angle, the baby will have to like pull the other part of the breast into its mouth instead of just worrying about sucking. You could have possibly the baby's head too high or too low to the breast. And that again will cause the breast to kind of pull down away from the baby, and the baby will have to pull up instead of just sucking or swallowing. And then I think the one I most commonly see is the bottom one, where the mother does not have the baby lined up side to side, and she's always trying to pull the breast to the left or the right or push the baby's head to the breast. And that's just not ideal. The baby's gonna feel the breast just not sitting in the mouth and start to bite down. And we don't want pain and we don't want damage. We can deal with that. We can deal with that if we can find it before a breastfeeding parent gives up. All right, next slide. So here's an example of what I was talking about, like I see in the hospital all the time, is the side-to-side alignment of the baby's mouth to the breast. And actually you don't want just the mouth, you kind of want the upper lip nose area, because you want the head to go a little far back, and that's what you want lined up there. But as you see on the top two pictures, if you're not the breastfeeding parent, but the parent that's there helping, talk to the breastfeeding parent and say, hey, I see that the baby is not aligned. Let's try to scooch the baby over this way or that way so that we're not curling the baby's neck forward or having to move the breast. And don't be in such a hurry, because you got to get the positioning right before the latch and suck will work. All right. And I accidentally put two images above each other. I didn't think I'd do that again. So probably the angle is one of the harder things to get to. And the first thing you need to do is look at the breast, just look at the breastfeeding parent, and look at how the breast just lies and points naturally. So you see in this picture here on the top that the mother does have her shoulders and chest open, and that is bringing her breast up. And for even some people, it can help putting a little bitty burp cloth or wash rag under the breast. That's what you see in that picture, just to lift it up a little bit more so that the baby can get better access to the areola nipple area. Because as you'll see later, we really want the chin of the baby to be buried in. And if the breast isn't up, it's hard for the chin and face and everything to be pressed against some breast tissue. So once you can imagine a line, or imagine where the breast is pointed, as you see in the bottom picture, that breast is pointed along that blue line, then that's the angle and the alignment that you want the baby's head to approach the breast at. Or not necessarily approach the breast, but just when you're in your final breastfeeding adjustments, that's where you're trying to end up. Because as you'll see in my next video, we do want the baby to latch herself mostly, and sometimes you don't just go straight on, you have the baby against the breast and kind of helping the baby find the nipple. So this is more of like what you think would be the ideal positioning at the end of the breastfeeding session. All right, next slide. All right, so there we have the picture of the very good alignment. And you can see now that the baby's head is right in line with the nipple in the breast, and that's what you're looking for at the end. But first, as I said before, you need to check how the breast is naturally lined before you get everything lined up. And take your time. The baby might be crying. If the baby's crying too much, you know, either parent needs to do a little skin to skin and calm the baby down, because the babies don't nurse well when they're crying. Just like us, if we're flustered, kind of like me before this video, we don't do the right thing sometimes. All right, let's go to the next slide here. So this is a problem that I very commonly see, and a lot of parents seem to be very worried that their baby can't breathe. And that does make sense. I remember when I had our twins that are now 12, I was an intern, which is your first year in pediatrics training, and I was clueless. I was no help to my poor wife. But we made it. She breastfed her twins about 10 months. So good job, Trish. So to be perfectly aligned and symmetric, you want the nose, or most importantly is the chin, as we talked about. The chin should be pressed into the breast. That is like the most important thing. And then both cheeks of the baby should be touching the breast. Now, if one cheek is touching and the other one's not, that means the baby's head is a little tilted to the side. So you want both cheeks to be touching to know that the baby is straight on. And then the nose should either be right up against the tissue or it can be buried depending on how generous the mother's breast is. It could be completely buried, or if a mother has a pretty thin breast, maybe the nose is just like 1/4 of an inch or just the teeniest little bit off, and that's okay. So just don't be worried that if the nose is covered that the baby can't breathe. Their nose is stiff, they can always breathe. And if they can't breathe, they'll just get off. And you'll know that when your baby gets sick later on, when you're having trouble nursing with a sick baby. The other thing is, a lot of people do find it or do think it is important to pull back on the breast tissue and see the lips of the breast. And I used to teach this myself, but I think it does cause more problems than not. Because what happens if you pull back on the breast tissue? The baby's gonna feel the breast pulling, and they're gonna bite down to try to keep the breast from pulling out. And biting down causes pain. Also, people wanna pull back the tissue and almost definitely want to look for the fish lips the whole time. And if the cheeks aren't touching the breast, the baby is probably going to have trouble getting enough breast in the baby's mouth. And people might be asking, like, well, if you don't see the wide open fish lips, how do you know that the baby has enough breast in the mouth? Well, as I'll teach in my adjust video, which is the 4th one, that I prefer a method where you get the baby onto the breast, let the baby do that mostly herself, and then the breastfeeding parent makes little bitty adjustments. That's what adjust stands for. Up, down, left, right, rotate this way, rotate that way. And then you trust the breastfeeding parent's instincts and feelings to find where the most comfortable spot is. Instead of pulling back on the breast or letting the baby kind of fall off the breast enough so you can see the fish mouth. That works for a lot of people, and it's easy when it works. The method where you wait for the baby to open the mouth and then get the chin on and then slap the rest of the baby on. But for some people, it doesn't work very well. It causes a lot of stress. The baby's crying because you've had to take the baby off a lot when the baby's uncomfortable. So that's why I find this 4A's method so much less stressful and more productive than looking for the fish mouth and checking the lips, checking for the flange, people say. So instead, look for these 4 points. The 2 cheeks, the nose, and the chin should all be right up against the baby. If they're all touching, it's very likely that you have some great alignment. All right, let's go on to the next slide. To our bad example. And thank you guys for the comments I'm seeing. I hope this helps parents as you're saying. So in this bad example, it's not the best bad example I could find, but you can see a few things. The baby is facing the parent with the face, but the rest of the baby is kind of twisted and sitting in the mother's lap. So the spine's not the worst, but it could be maybe a little bit better. So it's not the best example of a bad spinal positioning. Sometimes you do see babies sitting in the mother's lap and their body's twisted like this. That would have been a better example. But you get the point. And then you see the mouth. You can see the baby's nose. You can see the baby's lips. You can even see the baby's chin a little bit. So that means that the baby is just barely on the breast. The baby's right cheek is probably touching, but the baby's left cheek doesn't appear to be. So that means the angle of the breast is a little off. It would be helpful if that mother could maybe put some pressure on the upper back and get the baby closer in to the parent. So again, on this one, you see some spine alignment, just a tiny bit of spine alignment problem, but you definitely see the face alignment. The baby might be a little too far past the breast a little bit too. But again, sorry, this is not the best example of bad alignment. All right. So again, in summary, straight alignment has 2 parts, the spine and the head. The head's probably the most important and the one maybe new parents and maybe nurses in the hospital might not teach you about having the face completely buried into the breast, which is very important as we talked about. Because we don't want the baby to feel any sensation of the breast slipping out of their mouth in any direction or they're going to bite down. And with the spine, again, if they can't stabilize themselves well with their hands and feet, which as you heard in my first video, when they're against the breastfeeding parent and then their face is there and their spine straight, their lower body's stable so that they can move their head. But if they can't do that, they will bite down to hold themselves in the position, and that, as you know, would cause a ton of damage. All right. So again, I'm Dr. Russell Homan, both a board-certified pediatrician and lactation consultant. I'm recording this video out of my office here in Tallahassee, Florida. You can visit me at canopypediatrics.com, where there will be other breastfeeding and educational videos. I'm also a positive parenting program provider for children and adolescents, for kids that have like anxiety, stress, bedtime problems, and I will be having some of those videos in the future too, so not only breastfeeding. So yeah, visit my webpage. There will be a blog on there too that I've got a few posts on. There's downloadable parent information. And yes, I am taking new patients here at canopypediatrics.com. Right now, the first 2 newborn visits are in the comfort of your own home, because it is so important for a breastfeeding couple to learn how to breastfeed in their natural environment. We all know that you could come to the office and breastfeed well, but then you get home and then you're like, how did this happen? I forgot how this worked. Why is it not working here? But then for some people, you don't have that opportunity to learn to breastfeed in your house with a lactation consultant or certified lactation counselor. And there are good offices out there. Like, for example, here in my office, we have a sofa that does have a fold-out bed so that you can learn side-lying here in the office. So yes, contact me with any questions. Thank you for all the comments. And my next video will be this Tuesday, which will be allow, which is kind of complicated and different. So tune in. Thanks. Let me see if there's any questions anyone posed. All right, well, that's it. Everyone enjoy their Saturdays, and I'll see you next time.